Good day everybody, my name is Wendell T. Hilikami, a third-year nursing student from University of Mindanao. And for today's video, I will be going to perform a return demonstration about nasogastric tube feeding. A nasogastric tube feeding is a device that is inserted into your stomach through your abdomen. It's used to supply nutrition when you have trouble eating. The purpose of tube feeding is to provide long-term nutritional support and to regulate flow of liquid nourishment by bolus, by continuous and intermittent feeding, or by feeding pump method. So here are the materials needed. A tray containing water in small container, prescribed feeding, 50cc syringe, feeding pump, disposable gloves, 4x4 gauze dressing, nasogastric tube, cotton tip applicators. So here are the step-by-step process of the procedure. First step is to check the physician's order for feeding, as this ensures that correct feeding will be administered. Second step is to wash your hands, because hand washing minimizes the spread of microorganisms. Then assemble equipments. Step 3 is to identify and explain the procedure to the client. Proper identification of client prevents medication error, and proper explanation allays anxiety and ensures cooperation.
Sir, may buntag.
Ako day si Nurse Wendell, imong nurse karon.
Sabi na itong pangalan, sir. Na, i-check na kung ID ban, sir, ha? Okay, Mr. Zach. Sir, naday ko ibuhaton ng procedure sa imuha, which is ang NGT tube feeding. So, magpakaon ko sa imuha, pinaagi sa imong NGT tube. Okay lang sa'yo, sir? Okay, sir.
Assess for food allergies, time of last feeding, bowel sounds, and laboratory values.
Sir, mangutana ko kung naba kay allergy sa pagkaon.
Wala.
When ka last nagkaon, sir?
Gabi, sir.
Ang sa oras?
Asok-sok.
Okay, mag-check ko sa imong abdomen sound, sir, ha? Ma-expose na ko yung tiyan, sir.
Proper assessment prevents risk of complication. Assess signs and symptoms that would suggest lack of tolerance in the previous feeding, as this to enhance gravitational flow of feed through tube and prevents risk of aspiration.
Taas na kayo mong bed, sir, ha? Okay, thank you. Pabutang ko ulan, sir, ha? Wala ka nag-isod.
Wash hands, because hand washing minimizes the spread of microorganisms. Expose the nasogastric tube, place the basin under the tube, and uncup the tube or remove the plug to start the feeding. Spread the paper towel on the chest area to avoid spillage of the feeding formula. Aspirate for stomach contents to verify placement. Reinstill aspirate if it is greater than 100 ml, delay the feeding for 30 minutes to 1 hour, and check again. Auscultate the abdomen for the presence of bowel sounds, as this reduces risk of gravity regurgitation. Pour warm water into a cup, then draw up 50 ml of warm water into the syringe. Gently irrigate the tube with the water. If the patient coughs or appears to be choking, do not administer feeding and notify the physician. Flush the nasogastric tube with 50 ml of water every 8 hours to prevent clogging in order to maintain patency of tube. Clamp the nasogastric tube to prevent air from entering the tube. Remove the bulb or plunger from the syringe, then reattach the syringe to the nasogastric tube to provide system to deliver feeding. Pour the prescribed amount of feeding into the syringe, open the clamp, and allow it to empty in, adding more feeding as the syringe empties. Follow the feeding with 50 ml of warm water to provide nutrient as prescribed. Clamp the tube before it empties and remove the syringe, as this prevents air from entering tube. Clamp or plug the end of the nasogastric tube to prevent infection. Clean and discard the equipment, disposable items in a plastic trash bag in order to prevent infection. Document the type and amount of feeding, amount of water given, and tolerance of feeding for information to the health practitioner and legal purpose. Monitor for breath sounds, bowel sounds, abdominal distension, diarrhea, constipation, and intake and output for possible complication to occur.
Sir, wala man nag-isdaging wala di kalibang constipation. Okay, check na kayo mga abdominal sounds, sir, ha? Expose na kayo mga abdomen. Okay, sir.
Instruct the client to notify the nurse if he experienced sensation of fullness, nausea, and vomiting to assess further client's condition.
Sir, igna lang niya kung makafeel ka o kaluya or kasukaon ba ka, naglain ba yung lawas, igna lang mi, sir, ha? Okay, thank you.
So that's all the procedure for nasogastric tube feeding. Thank you for watching and stay safe everyone.